Testicular cancer is common in young adults, and it's highly curable in early stages, especially with early diagnosis and treatment. Unfortunately, some patients might experience residual disease after initial chemotherapy, and these patients may need to undergo surgery, which is retroperitoneal lymph node dissection. It's a challenging and high morbidity procedure. So far, unfortunately, serum tumor markers or imaging haven't been able to help us with differentiate between different histological subtypes of testicular germ cell tumors, including teratoma, seminoma, embryonal carcinoma, necrosis after chemotherapy. So on the other hand, there's several promising emerging biomarkers like microRNAs. MicroRNAs are essentially non-coding transcripts that are involved in regulation of several genes. So based on that, we tried to study microRNA expression and differential expression in testicular cancer patients and see whether there's any differences in the different histological subtypes that could be related to diagnosis and prognosis. So in terms of methodology, we actually conducted microRNA differential expression analysis across different histological subtypes of testicular germ cell tumors, followed by a ROC analysis to find the most significantly upregulated and downregulated microRNAs. Then we continued with assessing potential associations of the microRNAs with AJCC stage and distal metastases. To prove our functional relevance, we conducted microRNA target network analysis, and we also finally assessed the expression of these microRNAs in patients' body fluids. So on microRNA differential expression analysis, we found a significant number of deregulated microRNAs across different histological subtypes. There were several that were downregulated and others that were upregulated with usually about 2.5-fold of difference. So we identified 7 microRNAs with significant upregulation and another 7 microRNAs with statistically significant downregulation among the different tumor types, including seminoma, embryonal carcinoma, mixed germ cell tumor, and teratoma. Both microRNA signatures had a very high sensitivity and specificity for differentiating between different histological subtypes, with the area under the curve for the upregulated signature being 0.98 and the area under the curve for the downregulated signature being 0.96. So we then moved to examine whether there's any potential associations between the microRNA signatures and clinical characteristics, including AJCC stage and a presence of distal metastases. Both signatures were significantly associated with the stage and the distal metastases, which suggests their potential prognostic role as well. So from a functional standpoint, we conducted a microRNA target network analysis and found several microRNA target genes that are enriched in processes involved in cancer, particularly PI3K signaling, cell proliferation, and cytoplasmic organization. So finally, we went on to assess the detectability of these microRNA signatures in patients' body fluids. It looks like they are detectable in blood, serum, plasma, predominantly in the urine. So taken together, our findings suggest the potential relevance of 2 novel microRNA signatures in differentiating between different testicular germ cell tumor histological subtypes. And these findings, if prospectively validated, could have both diagnostic and prognostic implications and could facilitate patient stratification for various treatment strategies.